Hello friends, I am Dr. Sunil Apsingi, orthopedic surgeon at Medicover Hospitals, High Tech City. Today we shall discuss about shoulder pain in diabetics. This is a very common problem. Sometimes we have people who come in who are diabetics with shoulder pain, and sometimes we see people who have shoulder pain and then later on we go on to diagnose them to be diabetics. So what is this? Most commonly, these people describe a pain in the shoulder which is very severe in the nights, very severe doing certain activities like reaching their back and combing their hair, not being able to put on clothes. Usually there is no history of injury, or if at all, a very small mild injury. So more often than not, these people, they have what is called as a frozen shoulder. A frozen shoulder is also called adhesive capsulitis, and as the name suggests, this means that there is a restriction in the shoulder movement. That is, the joint capsule on the inside of the shoulder joint, it contracts. There is a lot of inflammation there, scar tissue, and what it does is it doesn't allow the shoulder to move. Whenever the shoulder moves, there is severe pain. These people, they normally come to us with very severe pain, and the treatment for this involves number one, investigations, which is usually getting an X-ray done. Normally the X-ray in these people is pretty much normal without any signs of arthritis. However, once we examine their shoulder, their rotations are completely restricted. They can't reach their back, they can't reach their head. It is very difficult to button their shirts. It is very difficult to put on the clothes. Once the diagnosis is confirmed, then the treatment depends on number one, the diabetic control, that is the control of the blood sugars, and number two, pain control for the shoulder. That is giving some analgesics, that is painkillers. The most important aspect of treatment for these people involves physiotherapy. Physiotherapy involves taking the shoulder through a range of movement, and it is a very painful process. It is very easy to prescribe physiotherapy, but then it is very difficult to do physiotherapy for this problem. So normally what we suggest is the patients to take some analgesics. Before they start physiotherapy, put some hot packs on the shoulder, take some painkillers, and then start physiotherapy. Only then they can tolerate the exercises which are required to unfreeze the shoulder. These exercises are called capsular stretching exercises. These are very specific to the shoulder joint. Some of them need for you to lie down in a prone position, and some can be done standing, some sitting. Normally what we are trying to do is we are trying to stretch out the shoulder joint, especially the front and the lower part of the shoulder joint, which is all frozen. So we want to stretch it out by getting the arm out in that position. And this is very painful. That is the reason why they need a painkiller. For some people who are unable to tolerate it despite the painkillers, then we go to the next step wherein we inject a steroid into the shoulder joint. But be careful, make sure that your blood sugar levels are normal before you take a steroid injection, because a steroid injection can result in infection. If your blood sugars are not under control, a steroid has got a risk of introducing injection into the shoulder joint, which can become a lifelong problem. So if the steroid also doesn't work, which is very unusual, then some people need surgery. What is this surgery? They need what we call an arthroscopic surgery, where we put in a camera inside the shoulder joint, assess the amount of inflammation, and then we cut the inflammatory tissue under site in control. There is something called manipulation under anesthesia as well, which is done very commonly for this problem. The problem with manipulation under anesthesia is A, it is uncontrolled, B, an excessive force is used, and sometimes this can cause fractures, and sometimes this can cause what we call rotator cuff tears, that is, tear the muscles inside the shoulder joints when it is not actually necessary. So a controlled arthroscopic release is far more preferable than an uncontrolled manipulation of the shoulder joint under anesthesia. Most of the patients, however, they recover with analgesics, proper physiotherapy. It is very unusual for us to operate on someone for a frozen shoulder. Thank you.